Hello, everyone. My name is Robert Lucero. This is my drug educational infomercial. Today, I'm going to be talking about methamphetamine. And so, with today's lesson, we're just going to go over a couple things, which is what is methamphetamine, followed by the scope of methamphetamine, the effects of the drug on the body, what the risks and consequences of the drug are, with a small commercial break, and followed by my references. Starting with what is methamphetamine. Methamphetamine is a highly addictive stimulant, which it takes a glass fragment form, and these may also look blue or shiny. As you can see from the picture on the right, you can see what methamphetamine looks like. It kind of looks like a glass shard or such. Methamphetamine is a drug similar to amphetamine, which is used to treat attention deficit hyperactive disorder or ADHD, and narcolepsy, which is the disease in which people fall asleep spontaneously. Some common names for this drug would be blue, crystal, ice, meth, most commonly, and speed. And so with this picture, you can see a couple examples. That sometimes they're very blue, it's really shiny, and then typically take on a glass form. How is methamphetamine used? So it can be used in a number of ways. Smoking, which is directly within a pipe, so it's placed within and heated on the outside. There are pill forms, which is swallowed and ingested into the small intestines, and then followed by snorting. Users would snort it by crushing it up and then snorting through their nose, followed by injecting, in which they would dilute the drug into a spoon and heat it up and use some kind of needle, typically a diabetic needle, into the uh, into the syringe and place it via intravenously. Now, one thing to note is that some users may switch to different methods of consumption to reach a better or longer high. Certain methods can enter the bloodstream a lot faster or reach its target goal a lot faster than others. It can also last a bit longer as well. So, moving on with the scope of methamphetamine, currently, as of 2019, over 14.7 million people have tried methamphetamine at least once. This is roughly 5.4 of the population, according to NIH. This also remains the most commonly misused stimulant drug in the world as of 2019. So, out of all of the stimulants, the use of methamphetamine is the most commonly misused. Now, once looking past the individual health, this drug causes a new wave of crime, unemployment, child neglect, or abuse and other social ills. And so, with that, while in 2005, this wave of crime and unemployment and all of these other associations past of individual health cost $23.4 billion to the nation in 2005. So the numbers aren't very clear as of today, but you can see it's very impactful. Good news is, however, there are many treatments for users of this drug in order to address this issue, and so far there are a lot of successful programs within today. And so, as you can see from the next slide, the national drug overdose deaths involving psychostimulants with abuse potential, as you can see within that, including methamphetamine, has been on the rise. As you can see, numbers trend from in 1999, going all the way up to 2017. You can see it ranges from a number of 547 all the way to 10,333. That's a high significant number for this trend to be going somewhere. Now, how does methamphetamine work within your body? As you can see through a diagram, once you had smoke it, all of the toxins from it actually go into your brain, followed by an increase in dopamine, which is known for movement, motivation, and reinforcement of rewarding behaviors. So, having this high level of dopamine release reinforces drug taking behavior, making the user want to reach that high and repeat the experience. So because it makes them very happy and brings a lot of joy, they definitely want to reach that same high again, similar to most drugs. Now, while off methamphetamine, users will live through withdrawal symptoms such as anxiety, fatigue, severe depression, psychosis, and highly intensive drug cravings. Now, many users claim to, you know, take drugs because when they try to quit, it would definitely make them feel disgusting and very unpleasant for the time being. And so, in a sense, their medicine would be for to take drugs, to take meth. Now, moving forward, the effects of methamphetamine on the body, there is a short-term effects. So while on it, you have increased wakefulness and physical activity, so you seem very jittery, along with a decreased appetite, faster breathing, rapid irregular heartbeat, and increased blood pressure and body temperature. Now, keep in mind this is a stimulant, so it's going to activate a lot of things within your body and make you seem very active. So, it's supposed to work with your central nervous system. Long-term effects, these are more unfortunate. However, there is extreme weight loss, addiction, anxiety, intense itching, which is common, and it leads to skin sores. So you can kind of see within the picture, you see a very thin person along with a meth user who went from not using to a chronic user, and you can see that his skin seems to be very, very sore-like or very unclean and damaged. Along with along with the effects, there is changes in the brain structure and function. And moving forward, the along with that, there's a lot of confusion, significant memory loss, sleeping problems, violent behavior, paranoia, and hallucinations. Now, with methamphetamine, there is also a thing called meth mouth. And so basically, when you do take the drug, as you can see from the top picture on the right, there is a user who takes meth, and their dental hygiene isn't the best due to the toxins usually being absorbed while smoking it. So all of those chemicals and toxins going into past your teeth and gums, you start to develop what people would call meth mouth. One thing that people should understand is that although meth is a drug, it also has an environmental effect. So methamphetamine production involves many hazardous chemicals such as acetone, fertilizer, ether, red phosphorus, and lithium. This leaves a toxic trace around the meth labs that can last long after it was shut down. So another concern is how these labs are dangerously flammable and can cause significant combustion. So the CDC, the Center of Disease Control and Prevention, actually has a plan to clean up meth labs, and along with that, you can see that flammable areas can cause significant damages to homes, fires for neighborhoods, and other things like that. Some other things to mention is that with the risks and consequences of meth, secondhand smoke exposure of methamphetamine has been indicated to make those exposed to it test positive for meth, meaning that if someone was smoking meth around you and you happen to kind of get a little bit of exposure to it, you can test positive for methamphetamine. Methamphetamine has also been indicated to increase the risk of contracting infectious diseases such as HIV, hepatitis B, and C due to the increase of risky behaviors such as unprotected sex or the sharing through needles. And lastly, you can overdose on methamphetamine, which may lead to harmful symptoms or even death. So keep that in mind that this is a drug that can also kill you.